Hey, what's up, everybody? Going to be doing an interview with the Hormone Whisperer, or a friend that's known as the Hormone Whisperer because he's really good at that. Actually, I'm not even going to tell his testimony. I think that's probably one of the best aspects of just his story and what he's come to be able to provide as far as care goes, how he's able to help so many women across the globe. He's going to be bringing the talk, the Hormone Connection, to Clarksville, Tennessee. It's going to be on 10/19. 2019, be here in Clarksville, Tennessee. So if you live local or you want to fly, it don't matter. Come on into town and let's talk hormones. So Dr. Patrick, welcome, brother.
Hey, thank you. Awesome to be with you guys today.
Awesome. So give people a little short synopsis or a long synopsis, whatever you think is best. How did you get involved with female hormones? As a man, as a doc, as a chiropractor, as a wellness way doc, how did you get involved in that arena?
Well, I think that most people that have effect on the world actually were kind of thrust into something that they actually never had any intention for. And I say that being the fact that knowing my story's been out there for some time now.
Yeah.
Is I had some health issues myself as a kid, and that's what led me into becoming a doc. Okay, so I'll explain more of that at the Hormone Connection seminar. But what does happen, though, is I end up meeting, once again, this woman who actually had major health issues. Now, for you guys that know the story, I end up marrying that beautiful woman. But it came from a need from sitting there going, hey, listen, if we have some things going on where she can't have children, and that's the big part. I mean, imagine that you're presented with an absolutely, God puts this amazing woman in your life, and you've always wanted a big family, and then you find out that she can't have kids. And from just understanding the basics of biology, just understand the basics of anatomy, to me, that still makes no clinical sense. And when women are told that, they accept it because the current level of thinking that actually led to being that problem is trying to tell them there can be nothing done. Yeah. And I just looked at that whole process and said, I disagree. But I couldn't just say I disagree from a concept. I had to now sit there and prove it. And so then clinically, and this started once again, now 21 years ago, I started to look at how our current form of healthcare looks at females. And people say, Doc, with all the technology and all the advancements in medicine, it's probably gotten better over the last 21 years. Actually, it's gotten worse.
Yeah.
It's actually barbaric. And so then I started to put out ways to actually evaluate women different ever in history. I started to actually come up with ways to actually test women and teach them that has ever done in history. And then next thing you know, women from all over the world started to travel. And then I said, listen, if the doctors get these concepts down, which, for example, to you and I are so simple.
Yeah.
Okay. But you gotta remember, when you've been trained a way of thinking your whole life, and then you have a different way of thinking come in, it's immediately. I thought when I started to do this, and I'm here, I'm 25, 26 years old this time, I started to share it with other chiropractors, started to share it with other medical doctors, and I got the hand in the face. It's like, no, don't talk to me and stuff like that. And I was surprised. I was kind of blown away. But then I always tell people this, and at that time, at one time, Doc, it's not a joke. A lot of people don't know this. I thought about giving up. I thought about saying, listen, just stay quiet. Just go along with your business, have a good practice, have a good family. And then all of a sudden, but obviously it's not a joke, God starts tugging at your heart saying, no, I didn't create you for that. So I just went, just started to do it now. 21 years later now, we've had a great impact, and we're going to continue that. And then I started to speak about it. And next thing I know, I started to speak about male and female hormones. And next thing I know, people are going, oh my goodness, not only are we getting healthier, but actually we're having better relationships with our spouse because now we understand each other about males and females, because no matter what any political realm tells you, males and females are extremely different, both physically and psychologically. And if we don't understand
I'm glad that's true.
Yeah.
I'm glad that's the way.
But the sad part is this, even in health.
We got Anthony in the background, the camera guy, smiling too. He's like, I'm glad my wife's different than me. I would hate to look at myself in the mirror and make love to me.
Yep.
Pretty ugly when I look in the mirror.
But what's really funny though? If you look at what they do, even clinically with men and women, it's going to sound funny. It's not much different. I recently had a man put on Clomid, which, for example, even 10 years ago would not have been thought of being given to a man. And on top of it, now they're trying to manipulate people's hormones because they think they're a man, but they're really a female, or vice versa. And so the sad part is this: it's gotten worse, and the amount of hormonal conditions and illnesses, they're growing every year, and I believe that the message that we're sharing, once again, is not only physically but also mentally life-changing.
Whether we want it for our kids or not, right now, if we're eating the standard American diet and we're doing the things that every other American is doing, we are manipulating our children's hormones. I mean, I recently read that the number one cause of undescended testicles and low testosterone in men is, according to, of course, these scientists and these studies, but these are peer-reviewed medical research studies on PubMed, saying it's actually taking Tylenol while pregnant. It just causes massive hormonal problems in the developing baby, and if it's developing into a male, well, then you are causing serious problems by taking Tylenol. But that's just kind of a thing. So side note, kind of women out there, if you don't want hormones to be disrupted in your child and your baby boy, don't take Tylenol for real. So, but I got a similar kind of case there. Is like, my wife, I always joke around, if we didn't want 3 kids, I should have never adjusted her, because she was told at like age 16 she was never going to be able to have children. In which I literally just thought about this. I'm going to have to ask her when she started having cervical dysplasia. And so she had like the ablation procedure, burning basically of the inside of her uterine wall to kind of prevent cancer, all this stuff. And she had breast implants, I think, when she was like 16 years old. I'm going to have to ask her if her cervical dysplasia came about after her breast implants. I just literally thought about that because, after the procedure and, now we're dealing with some of the hormone to immune dysregulation issues of having breast implants now she's in her 30s, had the breast implants when she was like 16 years old. So I'm really trying to tug at her dad's heartstrings and make him pay for the explant, but I don't think it's going to happen. He paid for the implant, so I got to pay for the explant. Gosh, dang it! And most husbands are paying for the implants. I'm paying for them to get rid of boobies.
The explants,
But I mean, it makes a difference. When my wife is dealing with some immunological to downstream then hormonal issues. And I know this is something you're going to talk more in depth about, is the systems of the body. There's a downstream process and flow where immune system really does impact the hormones. And so really just, helping my wife out with that is going to be a blessing to our family and stuff. She's got to get through breastfeeding of our newborn, or fairly well newborn. It's been ripening off the vine for a little while now, Red's like 9 months. So, but, looking at that's really what I love the Wellness Way and what you've done for my wife, because just giving us some guidance on when we did the blood work on her hormones, when we did the Dutch study, when we did these things, it gave us some clues of, okay, her body's functioning well in this arena. Here's where we can support it throughout the breastfeeding stage. And then once we get through that, we're supporting and assisting her body right now, because you can't do too many aggressive things. We can't get an explant, get rid of something that causes an autoimmune type response, while she's breastfeeding. So we're waiting so there's only so much we can do there. But like you said, dealing with fertility and hormone issues is barbaric. I've got a recent patient dealing, and I did a live on this and talking about how she's actually got pernicious anemia and she's got gastric parietal cell autoimmunity. So she's got autoantibodies. Her immune system is attacking her digestive tract, and it leads to a B12 deficiency. And literally, I asked her, did they test your hormones, test you for anything? And she's even got scleroderma. She's got inflammation of her skin. And she had positive antibodies. They weren't really extremely elevated because she's reduced. She's eliminated all grains and gluten, which she had a gliadin autoantibody. So she can't have that ever. But now we know her immune system would have been triggered through eating that stuff. Well, she's already eliminated that stuff, so it's helped her skin. It's helped her immune system. She's got an explant. And now we're still dealing with this gastric parietal cell autoimmune condition, and that leads to B12 deficiency, and she's gone through multiple losses, losing babies. And I asked her, did they test your hormones? They tested like follicular stimulating hormone, and they tested like progesterone, and they're basically planning on just giving her progesterone after in vitro fertilization. Like that's all they do. And I'm like, So if she's B12 deficient, you're going to leave a mother and you're going to force a pregnancy on a mom and try and make her hold it with progesterone.
Good luck.
And then you're going to lead to a child that has mental health conditions, depression, or even schizophrenia, to autism, to incomplete, complete, I don't want to say brain damage, because if they never formed their brain properly because they're B12 deficient, now you have a child that has serious medical needs.
Issues.
It's like they're so wrong in what they're doing. Like this scenario was like, for me, just like, this is so wrong with the way they're approaching this. Every child that's brought in the world is a gift from God. But the reality is, if we're doing it outside of the scope in which God would want us to do it, which is the restoration of healing and becoming whole, and that's what these women need. They need to be restored to being whole. So what are some of the things you're going to talk about helping women, get on that right path?
Well, and my whole goal that whole night is to get to change their thinking.
Yeah.
I've always said this. We don't hold doctors and healthcare providers accountable. And what I mean by that is if you're the dominant form of healthcare for women and you're continuing to be sick and you're continuing to have more fertility issues and more hormonal issues that way, when do the public finally really go, where the blind's leading the blind? You know what I'm saying? And so if I don't get people to think differently, they're just going to end back on their same care that they've been through that way because they've been trained to do that. And so we're going to spend a lot of time actually really showing them how to understand what's going on with their body so they know what choices to do. And then second of all, once again, a lot of people realize, like, I just got a sperm analysis from a guy that, no joke, him and his wife are having some infertility issues that way. And it was interesting because I like to, especially when it's a couple been trying for a while, I have both the male and the female tested. We'll get back to the female testing in a second. But the guy's actually sperm counts were pitifully low. And it's interesting because he's like, I'm a healthy male. And I'm like, how do you know that? He goes, well, my doctor tell me I'm healthy. I said, no, what he meant is you're not dying. You're not healthy. Your sperm count, you couldn't get her pregnant if you had sex on the perfect day and stuff. And so it's like, and then the funny part was the woman who we started to take care of, and she's only 32 years old. Like you said before, the woman that you dealt with, this seems so simple, but I want you, if we can get this one concept today, which can change the direction of every woman that ever listens to this interview today, is this. When I looked at my wife and I said, let me see what testing you have. That's why people say, Doc, where'd you ever come up with the model, the wellness way? We don't guess, we test. And it's very a general statement because here's why. My wife actually, when I looked at the labs and stuff that she had done, because remember, I didn't meet her, and fertility wasn't the biggest aspect. She had what? Endometriosis, cystic acne, Crohn's. She had headaches. And so therefore, and that led to them wanting to possibly remove her uterus. And therefore, once again, and they told her the chance of having kids is nil to none. And that was just the side effect of her being sick. But I said, let me see what they've done with you. And no joke, I know this sounds funny, but they measured, like you said with that woman, only a couple hormones.
Yeah.
How can we properly assess a woman or a guy with incomplete testing? And let me give you an example. It's like watching the preview to a movie and trying to judge the whole movie. It makes no sense. So I just said testing's incomplete. And that changed the form of female healthcare 21 years ago. And then I started to test people, go, oh, they've missed this, they missed this. And even if they tested it, and they test like I do, we do, they still wouldn't know what to do with it. So that's why I believe the hormone connection and teaching women and guys this will actually dramatically change their thinking, and now they can take different actions.
Yeah. I mean, it's funny you say that because I'm like, I remember like watching I forget which movie it was. I don't know if it's Marvel's or whatever. And I was like, oh, this is going to be an awesome movie. I watched the preview and I'm like, that's it. That's the movie I got to watch. And I went and watched it. I'm like, this is a horrible movie. I could have watched the previews and that would have been all I needed to see because that was all the funny parts. And it's kind of the way they do it in like, okay, the woman's progesterone is low. So, that's the reason you're infertile and you can't hold a pregnancy, but yet she's infertile and her progesterone doesn't go up because she has massive immunological stress that her body, and I told the woman, I'm like, you have to understand, I know it's probably not gonna help a lot that you've lost another child, but the reality is you have to understand that That, to me, I'm like, you know what, God said, you know what, your body's going to function properly, and it's not going to bring a child that's going to develop abnormally and be disabled for the rest of their life and have to suffer. It's not going to bring that child into this world, because that's not good for the child. That is not, so that's like, they look at one thing, they force a pregnancy, that's just one example, but they do snapshots. And the reality is they do these snapshots and they test these hormones. They will increase the testing of certain hormones if they have a drug to alter those hormones.
That's a big key right there.
They only test what they can alter or what brings about, see that number, it's high or low. This is the drug you need. That's all the reason they do testing, period.
Mm-hmm. That's it. So. And see, that's what happens. A lot of people say, Doc, well, why didn't they ever do it? Because gotta remember, our current form of healthcare, okay, let's just call it the medical system that way, is they actually, that's why when I decided to create analogies, like you guys are gonna learn a lot of analogies because once again, we're trying to change people's thinking, you gotta give them analogies and parables that way. Yeah. So I said, medicine, they're the fire department.
The greatest teacher always did that.
Yes, that's right. I said, listen, if you actually, have a house on fire, do what you gotta do so you don't lose your house. But that's not how you take care of a house. You need a carpenter to rebuild it. So medicine basically is the fire department, and we built our whole healthcare establishment. Remember, they used to talk about health. Now all they talk about in all clinical things is management. Yeah. So we have a management system. Exactly, and we accept that as normal. We accept PMS as normal. We accept these things as normal. And then we come along and we give a better idea that gets great clinical results. And then we are flagged on Facebook. We are listed as quacks. We're listed as those things. Yet we have the most vital, basic biochemistry and physiology, and that's the struggle. See, when you come to the Hormone Connection Seminar, let me tell you, you'll be excited, but you will struggle. You will struggle because everything that I teach you, you can apply the next day, and it can change the direction of your life. But you're going to be taught something against what you've been taught your whole life.
I mean, the maker of Facebook is married to a medical physician. I mean, if we started promoting all the things that Wellness Way does for people, we would cut into her profits. And not that she needs to make money, but when people have a lot of money, what do they want more of? They always want more money. And she's a front group now for her, her industry, that industry of medicine. And the reality is it's not doing right by people, completely right by people. There are great skilled surgeons there for the emergency situation. God forbid it ever happens, but the reality is they're not restorative. They're not healing in nature. They are treatment of symptoms or disease care management while you progress down the path, and they hope the symptoms don't escalate as fast. It doesn't mean you're going to live longer. It doesn't mean you're not going to suffer as much. They hope this arthritis doesn't make you suffer as much as over here, the infertility issues, the hormonal problems, the vaginal dryness, all the stuff that comes along with the drugs they're giving you, the frequent illnesses, the colds and the flus, and all this stuff. So as long as we kept your arthritis at bay, now you can deal with all these things over here, and you're dealing with the things that are sidebars or downstream from the major issues. So
right. And the nice thing is this. And I know we talk a lot about where it seems like, things are bad. Well, things are bad because once again, you're listening to people that actually lead you down that direction.
Yeah.
What we've done, and that's what happened in clinical practice. That's why when I started coming with ideas, doctors rejected the ideas that I put out there because they saw there's nobody that tread that path before. A lot of people say, Doc, you were at one time a fork in the road. I said, no, I wasn't. I would love the fork that somebody else would have treaded this path to see this down that road, but they didn't. Everybody had just molded more into, we've seen this come up so much. People have moved more into natural practitioners. And, here, instead of using this drug, use this herb. And I'm like, that doesn't work that way.
Isolated nutrient, something like that,
Yep. Doesn't work that way. And so that's what we're going to really cover that night. And trust me, and it's going to be fun. I'm going to make you laugh because there's no way that you can not talk about male and female hormones and talk about sex. You saying so? Women always say,
talk about
how do I get there? Exactly. And I would say, they say, how do I get my husband to come? Because they think it's a girly hormone seminar.
Yeah.
Ladies, let me tell you right now. I promise you, your husbands will actually probably even sometimes enjoy it more than you do because they will actually understand how to get more sex out of their wife.
Yeah. If men could understand why stress hormones and how stress hormones negatively affect female good hormones that are their sex
Sexual.
drive,
They're
you know
sexual,
what?
yep.
They'd understand why doing the dishes has a good end result. They'd understand why
yes.
helping to clean the house. They'd understand why I said I should have taken a picture last night. I was riding the four-wheeler with Magnolia sitting in front of Amos. Amos right here. I've got Ren strapped to my chest, and I've got our dog on the back of the four-wheeler. I'm like riding around. I'm like, and stopped by the neighbors. We just, we're checking fields for deer and stuff. And I'm like, because my wife, when I got home from work, she said, "Can you take the kids for a moment and just let me have a few moments alone?" And I'm like, "Sure." What's the best way to babysit 3 kids and a dog? Jump on the four-wheeler. The kids love it. You know what I mean? You just give your wife some of that alone time that she deserves and she needs. And I know my wife's probably always going to be like, "Hey, Dale, you remember what you said on that live with Patrick?" Yeah.
Yes.
You need to do a little bit more of that. You're on the right path.
Yes.
But I mean, it really has. Some of your live videos, is just, and your mindset. I just keep, I'm learning more from you. And just, it's a greater and greater understanding, but it really has led to a better relationship in our marriage.
Yes, it does.
Between me and my wife. Because now I'm understanding that I can't come home and be like, "Hey, I'm going out to the woods real quick because I want to get this extra stuff done." And she's like, "Yeah, but I've been home with the kids and I haven't got anything of what I want to do done." And then I come back from the woods. I'm like, "Hey, babe, I just got some hunting in. Can we have sex real quick?" And she's like, "No."
No. Yep.
And I'm like,
Yep.
"Well, why not? This would be the best day in the world. I got to hunt and now I get to have sex." And she's like, "No, it's not going to be the best day in the world because you got to go hunting and I got to stay home with the kids."
Yep. Well, and here's a prelude to one of the things we're talking about. And I can honestly tell you, after all in all the medical schools I ever spoke at, all the naturopathic, chiropractic, no one has still disproved me wrong on this. And you set it up perfectly this way. You want to talk about one of the major things that will destroy a woman's hormones is just mental stress.
Yeah.
Mental stress.
Yep.
And if guys got that concept, and I've said this at our book launch.
They understand
I've said this, everybody. Yes, then they understand that they can be a big contributor to what's going on, but they also can be a big contributor of why they do so well also.
Yeah.
And that's a big key. And so when you can start to really understand it, and that's why, like, ladies, trust me. And you say, "Well, Doc, it's going to be more pro women." No, it's not, because the end result is when you have a healthy, vibrant woman, the end result is, remember, the number one reason why men and women fight is sex and money.
Yeah.
It's one of the number one reasons for a divorce. Do you understand? And so it's like, so the concept of just figuring out hormones made me a better husband, made me a better CEO of a company that has over 100+ women that work here, because I can't have stressed out women that end up sick in a company that promotes health.
Yeah.
So it's a much different way of looking at just even men and women in difference in general. And now the churches from all over the world start to actually pick up my teaching. They're like, I have these pastors going, "You got to come speak to my congregation for healthy marriages." So it's been pretty exciting.
Well, I mean, it's so true, because, I mean, we had frustration in our marriage when we had kids early on, and it's like sex number of times per week or whatever, and it used to be per day at times, it's like, now it's like, oh, we got 3 kids and she's stressed out and hormones aren't there and stuff like that. If men understood that, there was frustration. There was some, like, what do you mean? Before kids, it was like, come on. And, it was anytime, every time, and now it's, but if men would understand that, they'd understand, and I understand now why with immune system, hormones, things like that, the weight doesn't come off as well, those things. And then a lot of husbands get frustrated. "Why don't you go work out?" And they're driving up their wife's stress hormones.
Stress hormones.
And they're not getting the sex, so the husband's getting frustrated. Then he's getting mad at the wife because she's not in shape anymore, all this stuff. But yet he's the source of the problem. I actually treat multiple ladies and help them. And sadly, some of them are like, the husband's done. He's over with, you know what I mean? But they're like in a relationship, but they're done. And it's sad because had the husband understood why the wife's hormones were out of balance from the get-go, he could have been proactive in helping her lose the weight, helping her get back in shape, helping her increase her sex drive. You know what? And it wouldn't, obviously women could be like, "Well, that'll be a selfish reason that he's doing the dishes." It could be, but ladies, would you rather him do the dishes than not do the dishes? Like, give him some incentives there. But it's understanding the way the female body works could massively help. And obviously men can benefit from understanding why stress hormones deplete our body of testosterone and our sex drive, our ability to get erection and all these things. So it's like, it's going to have benefits across the board for individuals, but also massively for relationships. And if we can catch and help these women deal with the stress they're under, but have their husbands understand the stress that the husband is inducing, the woman can get and achieve the goals that the relationship needs or wants, you know, to be able to come back together as a healthy physical and emotional marriage and spiritual marriage as well. And we'll save marriages, you know, but we got to get them before the husband's thrown his hands up and said, I give up and I don't want to be a part of this relationship anymore because you won't have sex with me or you won't do this or you won't do that. And yet she's not doing those things because of him and the way he acts and the way he treats her and the way he doesn't do. And a lot of times it's what you don't do. It's not necessarily that you're treating her bad. You're doing things to the person. It's a lot of times what you're not doing that creates that stress that some women don't want to talk about. With everybody has that. They don't want to bring that stuff to the forefront. So this could save a marriage. Get your husbands there. That's what it comes down to. Before they give up.
It's funny you say that. I just rebook actually. Some churches have used it for marriage, premarital counseling. But I'm not joking. I was like, a church use it for premarital stuff? Well, because once you understand, and you said something that I want to touch on. I didn't plan to touch on this today. Is women are always like, well, guys are so sexual. And I did a video on this recently, and I talked about if you look at a young man who's prepubescent and look at his testosterone levels, and then he hits puberty, his testosterone levels skyrocket like you're supposed to do. We see all the physical changes. We know that, okay? But the mental changes that come with that to a guy is actually, it's in every textbook, every understanding of biology is also increase their sex drive. You cannot separate hormonal health from sexual drive for a guy. It's impossible. And so trying to make a guy into a sensitive woman is against every biological factor there's to a guy. But now knowing that about a man, once again, and stuff like that is knowing the fact that, listen, that's why when people say, well, my husband has no sex drive, he's 30 years old. Well, he's either sick or he's chasing another woman because his biology is going to dictate that, okay? But on the flip side, instead of complaining about it, if you understood that, vice versa, if a woman understood what a guy was really like, it actually can work to her advantage. Vice versa. If a guy understands how a woman is, it can work to your advantage. And I started to go, and this all came from Doc, just looking at hormones from such a different perspective. Not only did we get the best clinical results with endometriosis, infertility, all the major hormonal problems, but then that psychological aspect that, once again, remember, as clinically trained, I'm trained in nutrition, naturopathy, chiropractic, all the major, herbs, everything like that. And I find out that I'm speaking across the world just on basically also on a relationship aspect too. And I've never had any training in that whatsoever. But I do understand and view physiology and biochemistry different than anybody else did in the world. And therefore, it transitioned into that. And that's the cool thing about our Wellness Way approach. It encompasses so many amazing things.
Awesome. Awesome, brother. So anything else we need to kind of pre-frame or rev people up on?
Here's what I tell you. If there's one thing I'm going to give you the biggest complaint to my seminar. Number one is their spouse wasn't there. If there's one thing I can ask you that way, we are, it's what, like Saturday at 10 or 11 o'clock, something like that. It's, trust me, use it as a date day. You understand?
It opens at
10 a.m. in the morning. Vendors and stuff opened up. You speak at 11 o'clock.
Yeah.
So
perfect. Like I said, use it as an opportunity to come there as a couple. Okay, because I promise you, I'm gonna ask it in the summer. I actually ask this every time because I guarantee the majority of people that are going to be there is women because they're suffering with so many hormonal type related diseases that they want to know what they can do, and I will give you great answers that day for that. Okay, but once again, that's the physical aspect. But there's a mental aspect of hormones that affect both men or women. That's when you're going to say, man, I wish my husband was here, or I wish if there's a guy, they say, I wish my wife was here so they could understand the difference. That's the big key. So if there's one suggestion, remember, now if you're single, it's perfect. Come. If you're the only person that come out of your relationship, great. But I tell people, bring your spouse, bring your fiance, bring your boyfriend, girlfriend, do what you need to do, because I promise you leave there, you'll be very, very, you'll look at each other and go, all right, I think differently.
And I think, yeah, you just hit on that's a big thing. We don't want to be like, okay, relationships, and that's a big reason why we want couples there. But the reality is, this is going to. I mean, if a woman, like, think about it. If a woman is dealing with hormone issues already before she's even married, she's dealing with irritability, depression, anxiety, all these kind of stress response symptoms. It makes it very hard to enter into any type of relationship or sustain a relationship, because that makes the guy like, what's going on with this woman? She's suddenly, emotional against me and stuff like this, and then show relationships end. So it helps to, be preventive about prevent a relationship from breaking down before you even enter into a relationship, by making sure that you are healthy, and that's what it's about. That's what Wellness Way is. It's restorative, it's healing. It's not just symptomatic, hey, oh, you have that? Okay, take this, and then tell me if it went away. And if it didn't go away, come back and we'll try this. And that's what I see so much. And it's like when it's approached from a quote-unquote, naturopathic functional med, or, functional medications, herbs or medications now somehow. And it's like, that's not the proper approach. I see people all the time getting, diagnosed with, low magnesium and all these other things, and they get these isolated nutrients. And I'm like, why are you depleted in all this stuff, though? Did anybody else ever search for that, try and identify that? And they're like, no, they did this blood work and it said I was deficient in B12. And I'm like, that's it? That's all they did?
That's it.
And I'm like, and they gave you B12. Yeah, and it fixed my problems. I'm like, it helped you feel better, but what else are you dealing with? And then they go through all these other things they're dealing with. I'm like, because B12 is not going to fix all these other things that come about from whatever is triggering the stress in your life. And the stress can be physical, it can be emotional, thoughts, traumas, and toxins. The three big things, that cause disease in the inability to heal and function appropriately. You've got people on, or we got people on right now saying they're from around the globe, literally saying they want to come. They're going to fly in, they're tagging friends. One of them saying she's going to come to another one. She's going to stay at a friend's house that I guess lives here, that wants to come to the. So I guess people really ladies really like the talk, One's even a nurse. She's saying, Brianna was saying that, I'm a nurse and I've been ashamed to admit that I was so guilty for going along with what I was taught for so long, So literally relating to what we're saying and things that aren't necessarily the best way of healing and maintaining and being healthy. So.
Well, and it's kind of nice because the perspective that these men and women are going to get, once again, it will literally change the direction of your life. You can't solve a problem with the same level of thinking that got you into that problem, and therefore. That's why that whole night, trust me, I mean this sincerely. I have nothing to sell you.
I just thought of something. Yesterday I was doing a live video on breast cancer, October's Breast Cancer Awareness Month, and I thought it ironic that we're doing a hormone connection, and there is a population of women who are dealing with breast cancer because there's a mechanism by which hormones feed and can create the thriving environment, that allows for cancer to thrive. It is not the sole cause of breast cancer, guaranteed. It's not the cause in any way, shape, or form, considering the fact that hormones are disrupted by something else, and they go down the wrong pathways by something else. And I told some of I was doing the talk yesterday on mammography and how Switzerland, the country, is banned in abolishing mammography screening because it doesn't save lives. It actually causes cancer, causes women to be treated when they shouldn't be in the first place. Talk to us a little bit briefly about just the hormone pathways and like, in essence, like proper testing, to me, should be before. Like, they're like, what do I do instead of mammogram? I'm like, well, you could do thermography, but again, thermography is going to tell you once you have the vascular changes and you have the inflammation in the localized tissues, that is, quote unquote, the beginning stages of possible cancer growth. Obviously, other vascular changes can come about because of an infection in the breast tissue or other things. But thermography is an alternative to tell you when you're in an emergency situation. But before that, how could proper hormonal testing help women understand their risk so that they can take action and get a handle on it and prevent cancer? So they prevent the thermography, and mammography shouldn't even be there, but they prevent those tests from ever coming positive. Speak a little on that real quick, if you would.
Well, just even think of it this way. I have 2 cyclic daughters, okay? Now you say,
so they ride bicycles, like cycling?
Yes, that kind of cycle. I wish, as a father.
I wish that was the only one. cycling they were in right now.
As a father, I wish my daughters never went from becoming young ladies.
Right.
Okay? But think of it this way. So I have a 16-year-old daughter. Okay. She's had her cycle for about a year and so. But here, I want you to think about this. Okay. So, and how are we going from thermography, ultrasound, everything that to this? Well, this is a different way of thinking. See, if, like you said, if you're thinking about having arguments of ultrasound or mammography, thermography, and they're 40 years old, you're already too late in your thinking.
Yeah.
We need to actually teach people at a young age to actually, because what happens is this, people say, hormone levels. Well, remember, if your estrogen levels get elevated and they're elevated into time and you have any immune deficiency, your environment's going to develop breast cancer. Yep. Okay. That's why people say there can be hormonal-based cancer and there can be non-hormonal-based cancer. Well, really what happens is this. Really comes down to you drop your immune system anyway, and you set the environment for that breast tissue to metastasize, you're going to get cancer. Yep. Okay. And then, so I don't care if you have the BRCA gene or not. It doesn't dictate cancer.
Doesn't matter.
Okay. But here's what does happen is this. But why don't we just keep estrogen levels, and there's multiple ones, actually at a normal level from the day they have their cycle to the day they actually die. And you don't even have to worry about mammography, thermography, and all these things. Because here's what happens is because those tests are still looking for disease changes in tissue. Well, those are preventable. I love this. I love how people say this. And this is I'm going to use a low statistic. And Doc, I've heard you use this stat before. We've all used this. But let me give you a lower stat. 90% of all chronic illnesses are preventable by lifestyle. Now, I've seen it high as 95, but let's go lower, 90%. So that means healthcare is really self-care. But who's teaching people self-care? They're not. They're reacting to their bad self-care because they're taught. Here's their idea. Do you understand? The only way of prevention that medicine even talks about is vaccines, but don't get me started on that. You know what I'm saying? That's their only idea of prevention.
Spontaneous ovarian failure following the HPV vaccine and serious autoimmune conditions, and that disrupt your hormones and cause you to go infertile. Yeah, I think the HPV vaccine is not preventive. It prevents something, but it's not what you want to prevent.
Yes, and see that. So the whole idea, we're not taught self-care. We're taught reactive disease care and management. See, so that's why it's like I don't even want to have a discussion about. My wife is 43 years old. We don't. She's never going to have a mammogram. But you know what we do every single year? Her hormone levels, all of her levels are tested. Her immune system is tested properly, so she never creates the environment for those tissues to grow.
Because if you see that stuff going down, the immune system being skewed in a certain direction, you know this is going on. Something's going on. You got to get a handle on it before those, God forbid, images that you have disease come positive.
That's right. It's an environment. See, that's the whole idea. For example, this. People say, "Well, Doc, I have the BRCA gene." Okay, let's say a BRCA. Let's say a BRCA 1, 2. Cool, I get it. Okay, I've seen it on lab tests that way. Here's what happens.
We can even test for the level of the expression. Even if you have the mutation, you can look at the expression of those genes. It doesn't mean it's completely non-functional. It's not as efficient. It doesn't express itself nearly as much. This is the problem with this idea of genetics causing issues.
No,
lifestyle
it's a response.
Tune up or tune down the expression of genes, even genes that are considered mutated. And there's other protective genes beside that. Otherwise, you would have been a never-ending blob of tissue cells from the day you were born. You would have been keep growing if the gene was the one that determined cellular death and replication. It's so bad.
I'm going to change the language a little bit now, and it's funny, and I want everybody to listen. I want to change language because I think medicine uses this to confuse people. So I'm going to change language a bit. Don't say genetic expression, even though from you and I clinically know what that means. Yeah, it's a genetic response. Yes, the gene responds to the environment. So the idea. So I try to get people to understand that you can have the BRCA gene. And therefore, if your 4-hydroxyestrone starts to go up, the gene responds with metastasis of tissue. It wasn't a mistake. It wasn't this. Your body responds. See, so that's why when we look at and this is the major concept of the wellness way, that if they don't get this concept across, and this is why functional medicine, this is why naturopathic, this is why medicine don't get this, is your body doesn't make mistakes. It responds to its environment, And see, they say genetic expression, but most of the public doesn't know what that means. So they say, yeah, genetic. No, they
It
respond.
can turn
so
on or turn
therefore,
off. It responds to the environmental triggers, the stress
Exactly.
triggers, the emotional triggers, the physical
Exactly.
triggers, the neurological triggers. So I
Exactly.
love that. I'm changing it right now because it's genetic expression that makes the difference, but it's expressed in different ways according to
Yes. The
a
environment.
response from the environment.
Yes.
Yeah, absolutely. Something else you said really quickly there I thought about while you were telling me, so your daughter started her cycle around, like the 16-year-old, around 15 years old. We're having children, literally 12 and 10 years old, these little girls having their period and developing breasts way sooner, and that is a major risk factor for breast cancer. But yet nobody's
Doc.
talking about they're not sitting down and they're saying, hey, your 12-year-old had a cycle, let's put her on birth control to prevent her cycle until she's a little bit older or she's excessively bleeding. They're not saying, holy cow, that is a major red flag for your daughter to have cancer in maybe her 30s and 40s. We should probably start looking at what has caused her to go into early maturation or puberty or mature early.
Doc, get this.
Oh my gosh.
Okay. Just yesterday.
So
now,
you have a 12-year-old, get your daughter. You
Watch
need
this.
mom, dad, get there. You need to be at this hormone talk.
Watch this. And not a joke that you brought this up. The youngest in practice I ever had that got her cycle was 7 years old. Okay.
What?
Yesterday.
No
Yesterday.
way.
I got text message from one of our docs
Holy
that
cow.
they just got a patient that had their cycle at 8 years old just yesterday. You know, and doc, you know this doc, okay? That they have an 8-year-old in their practice that just got their cycle. Remember, and I can honestly tell you, let me underestimate. I don't know, in clinical practice in 20 years, probably 400 or 500 kids 10 years and under that have gotten their cycle. See, it's now remember, but here's what happens. Now think about this. And doc, let's talk about this, being a male. Look at the development of young girls today. Their breast size are larger. Do you see what I'm saying? And see, so what happens, they're more early development. Now, once again, people say, well, doc, yes, their body is responding to a high estrogen-based development, especially, and I will say this just from even clinical proof of this, you can't be feeding your children soy-based formulas. You can't be feeding your kids corn and GMO-based things that now trigger an estrogenic environment. You can't be injecting female aborted fetal cells into a male, or male and female aborted fetal cells, aka vaccines, into your child, and not see the environment of the body respond. That's just what happens. Okay. And see, the sad part is this. And so we come along and say, hey, look at this. If we can change the environment of everything with the hormone connection, think of it this way, doc. Well, you even said it. I got you to think a little different. It changed the environment of your house, and it's less stress mentally, and your wife is healthier, and she has better sex drive.
So
but there's no difference. Exactly. Okay. And therefore is this. But what's the difference if we actually do this? If we change the internal environment of a patient from an adjustment, which removes stress, from their diet, which removes stress, from a food allergy, from an infection, from actually mental stress, it changes the environment, and things then are genetically programmed to respond normally. That's called homeostasis. See, it's so simple and basic that people try to make it complicated. So they actually try to manipulate all the physiology. God created it, knows what it's doing. The body doesn't make mistakes.
Yeah. And that's the thing, is it's so simple at times as being a clinician and a doc. It's sometimes I sit back and I look at what they've been through. I look at how many doctors they've gone through, how many drugs they've been on, how many tests they've ran, how many supplements they've taken, how many elimination diets they've been through. And I sit down and have a conversation with them. I'm like, your issue is stress. So why aren't you on any adaptogenic? I'm like, so you're on one for your gut, you're on one for your, to help with your mind, but your mind is cloudy because your cortisol levels are through the roof and you're stressed. And I'm like, I sit back and I'm like, so you paid like tens of thousands of dollars pretty much over the lifetime right now trying to treat an issue that is driven by stress. And if you aren't either eliminating that stress or helping your body adapt to that stress, none of this stuff matters. You're literally like trying to, throw somebody a piece of twine while they're hanging over a cliff. It's like with that supplement or that herb or whatever, if it's not the right ones for that person in that situation. Sometimes I sit back and I'm like, this is kind of a really easy case and you're going to improve really quickly. But it's like, I told Rachel today, talking about one client, one patient that just started with me, and I'm literally like, this is a pretty well cut and dry case. All right. I'm not going to go in detail into it, but I'm like, everything she's got going on is this right here. I know what it is. She's already discussed the cause and issues and things like that. I'm like, we fix this, she gets a ton better. But I'm like, I'm almost like, you look at tests, I know what her hormone tests are going to look like. They're going to look like crap, you know?
They always
do. And a lot of people are like, I need hormone tests because my hormones are off. I'm like, yeah, but your hormones are going to be off because of these things over here. So let's test these, let's fix these, and your hormones will follow. And I'm like, you get me? It's kind of like a struggle being a doc that actually thinks about the way the body functions, heals properly. It becomes a lot simpler to help somebody heal and recover their health. But I'm like, I could just do these other things and supplement the way, and they'd be a lifelong chronic, symptomatic treating patient of mine, instead of somebody else's. And that's what, that's just me venting my brain, thought today.
Well, but what you just said was 100% clinically relevant, because that's what we as practitioners deal with every day. And so it's like, it's kind of like, because they've been led such down the wrong path that here's this medication, here's this herb, here's this micronutrient that way, and here's this keto diet, and here's the fasting, here's stuff like this, and going, okay, understand that if it's not put all together, you're just a pony and dance just in the natural world. And then it eventually fails and people end up on drugs. And that's the part that I keep on laughing about, is the fact that it's like, and laughing not in a good way, it's like, it's almost like laugh trying to cry, because doc, think about this. More hospitals, more doctors, more nurses, more money spent on research, more fights about insurance, politics is coming up. Yet the rate of chronic illness, especially in women, is not going like this. It's going like this. And our mothers and our women and everybody are suffering. And this is, I've been in practice for 20 years, and I'm more intense about it now, because just like you said, when that woman walks me, I have the greatest confidence of what we can do to change their life. And I beg of you guys, please, like I said, and I'm just going to say this because I want people to know this. I don't have anything to sell you. I don't. So the Hormone Whisperer, I'm not going to sit there and here's all the major supplements you want. I don't do that. I promise you, when you leave, there's only one thing that's going to happen. It's going to change right here, and then your actions will be great different. So please, I want to see you guys there on Saturday at 10 o'clock.
It's October 19th at 10 a.m. when doors open. 11 o'clock, you start talking and teaching, and you said something about chronic disease. The reality is, October, they're going to be lying to you about breast cancer. You need to understand the hormonal balance, the immunological balance, the things that drive cancer. Please don't fall for the lies. They're going to try to tell you that more survivors are here than ever before. That's because of overdiagnosis. And the reality is this. You might see a statistically declining rate. You see the number of people dying from cancer is going up, but you see the percentage of the population dying of cancer actually is falling. But that's not because of better treatment. That's because we have so many more women dying in their 20s, 30s, and 40s from autoimmune conditions and other major health crises, or committing suicide because their hormones are off, their immune system's off. We're seeing a declining in longevity. We're dying sooner. So when we see these diseases like cardiovascular disease and cancers that typically kill people when they're elderly, we're seeing less of them die of that because they're dying way before. So then those statistics are massively skewed. So do not fall for the lies that come about during this October. That's my rant again. But Doc, I'm super excited. 10/19 at 10 a.m. in Clarksville, Tennessee. I'm telling you, the Hormone Connection, you can get your tickets. I'm sure Ashley's probably tagged tickets and stuff like that. I've seen quite a few people asking about where can we get tickets, how can I come, that kind of thing. They're $10 right now. That pays for Dr. Patrick's, he does this because he's a friend of mine. You know what? He's like family. Wellness Way Docs, we're family. We're doing what we can to change our communities. He's helping us with that. It pays his travel expenses, that type of thing. So just, get the tickets now. They're $15 at the door. Don't wait till then. Get your husbands, get your wives, daughters, get all Anthony's over there laughing. Get them all at the hormone talk.
That's right. We'll be excited to see you guys.
Dude, I'm so pumped. Can't wait to hang out and can't wait to see the
Yes.
lives change that come about because of it. All right, brother.
Yes. Excellent. Thanks for having me, guys. Appreciate
Yep.
you guys.
Chat soon. See ya.
Bye-bye.
Bye. Keep me on?
Yeah, keep you on. Could you give away some free tickets?
Oh, free tickets. Sure can. We said we were going to give away a few free tickets, and they said they promoted that beforehand, so I'm sure some people are still live. We got a big old question mark there. So I think, yeah, we still got like 45 people on live, so not everybody got off there. So Nicole Kane's on, Gina's on, near you. Is there any way to pay to attend virtually? I will check on that. We got somebody, Hano. This is primarily in person. This is Dr. Patrick travels. He speaks at large engagements on that type of thing. So this is more, I will get a lot of the information out in tidbits and stuff like that over time. But we will get you that stuff. I'm going to go with a question here real quick, and whoever can answer it the quickest, this should be a fun one, because most people don't know the answers, because you got to know stats and statistics. But that's me, so I'm like thinking, did you think about any other questions that maybe most people would know the answers to? Because my brain works on like major stats and statistics and all that kind of stuff. So,
I don't know, maybe like some hormone question or something about something.
well,
I don't know.
what is the hormone? We talked about it in the talk. What is the hormone that they basically use to try and force a woman to stay pregnant when dealing with infertility? What is the hormone they give them? First one to answer gets free tickets, and if you don't live in the area, please let us know so we can give tickets to somebody who can actually make it to the talk. Brianna, progesterone, she got it. Pitocin, no, Pitocin, they help to induce Rona. So, progesterone is right. Brianna Wilson Moody. Lindsay Chapman got it too, progesterone. Good job, girls. All right, Renee got it too. All right, we're gonna give out a couple, probably. All right, I want another one. Okay, let's do a Hanu progesterone as well. So, good job, everybody. I know that's tough getting that in. Sue said estrogen. Estrogen's the other opposite, so progesterone's one. The gut must be healthy to maintain good levels. Absolutely, David, you're right on there. That's why, again, I told you I did a talk about what is a less frequently identified, okay, I've talked about this recently, what is a less frequently identified cause of infertility that would also result in incomplete or delayed development of the central nervous system, leading to things like spina bifida and other things in children that could literally lead to a child being born with incomplete formation of their central nervous system could potentially lead to autism and other neurodevelopmental conditions, as well as cognitive problems. I talked about this recently. It's a cause of fertility problems in women. Okay, if you name anything around that subject that I'm talking about there, I will give you free tickets as well. So go ahead, get it done. MTHFR mutation, not specifically talking about that one at the moment. It's kind of folic acid deficiency. Brianna Wilson got it, which ultimately Lindsay Chapman could be right on there. The MTHFR mutatin. B12, Renee got it as well, so good job. B12, lack of folate. Yes, yes, yes. Good job. Everybody's, yeah, I like this. We got a smart crowd here.
All right,
So we're going to give out, I'm going to get a bunch of free tickets for people. So we're going to give them out to several people.
So we've got,
So,
did you say Lindsay Chapman?
yeah, Lindsay, I think, is up in Ohio, though, aren't you, Lindsay? Inflammation or B12 deficiency, absolutely. Folic acid methylation problems, yes.
Rhonda answered first up here with.
Rona did?
Oh, Rona, sorry, not Rhonda, Rona, yeah.
Yeah. I don't see it on mine, huh?
I see it on mine, she was first.
Oh, really? Must have been some other people still filling in like other things, huh? Why don't I see? That's interesting.
Lindsay says she lives, but she said I'll come.
If she wants to come down for that weekend, absolutely. We'll get you free tickets. So we'll get some free tickets. Actually, I see that we got, we probably got 6 or a half dozen or so ladies that answered correctly. So I'm going to give free tickets to everybody. So let us know if your husband will come, if they will come, or your loved one, or your spouse, or you know what? Or if you have a guest, a friend, or family member that you want to attend as well, we'll give you 2 free tickets each person that answered these questions correctly. We're not going to, not going to be like, oh, sorry you didn't type fast enough. You don't get the tickets. I'll help you out. Awesome. All right, everybody. I'm going to sign off here. I appreciate you all. Can I give it to my daughter-in-law that lives in Nashville? Absolutely. And I'm sure I'm probably pronouncing I'm always like Rona, and I think it's Renee.
Rona.
Yeah, I know. It's always like because I know her, and I've talked to her before, and I'm always like, I butcher names, and I always forget. Awesome. So she got it. Oh, Amy said she answered it first. I don't know why I don't see it on my cell. My cell phone's not showing me everybody's then, huh? I wish I lived closer, Nina says. I'd love to attend this. Are you going to share it on Facebook or those that can't go? So, Nina, this will not be live on Facebook. This is Dr. Patrick Flynn. This is his talk. He owns the content, everything like that. And the reality is he travels the world to do this. And so he gets a lot of invites. If he just put it online, it would be out there and then be done. He puts out talks and talks about subjects along this line every single weekend. Like Saturday, I think he talks 10 a.m. or 8 a.m. On Saturday, and that's, I believe, my time, which would be Central Standard Time. So you're going to get a lot of that information. We do get a lot of this information out online, thewellnessway.com, thewilddoc.com. Stay tuned for when we publish videos and articles and things like that in the regard of overall health and wellness. So, but the Hormone Connection Talk will be in person locally only, all right? So I know that I have a large following from around the world on Facebook and YouTube and stuff, so I do apologize that we're not going to be publicizing it online. But look for events in your area, look for a Wellness Way doc in your area that's doing these talks, all right? So get connected there, because that's the only way. Community and connection is the only way we really change a community. So connection is the only way to change a community, not community and connection. Connection within the community that revolves around helping people understand health to truly prevent health crisis and situations. So appreciate you all, love you all. I am jumping off here. Go grab some lunch with my wife. Love you all.